dominant variety. The autosomal dominant variety basically is, for example, one of the parent is affected. Here we are seeing that the father is affected. When the father is affected, you can see that in every pregnancy, there is a possibility that 50% chance that the child will have a problem, because only one gene defective from the father will lead to being affected or something. So either the mother is affected or the father is affected. Here is an example of a father being affected. The autosomal dominant muscular dystrophies are scapulohumeral dystrophy, oculopharyngeal dystrophy, distal myopathy, also type of limb girdle muscular dystrophy, and myotonic dystrophy. Strongly, so these are very strongly inherited disorders. Autosomal recessive muscular dystrophy, in which are carriers. So the mother, you can see, has one defective gene, the father has one defective gene. They do not transmit it to the child. 25% chances that the child, whether a girl or a boy, can be affected. 50% of the children would be carriers. So this is an autosomal recessive variety, generally seen when there's more consanguineous marriages in the community. In this condition, in these cases, autosomal recessive type of muscular dystrophy is much more prevalent. Examples again are limb girdle muscular dystrophy and congenital muscular dystrophy are known to be autosomal recessive type. Let's look at what are the symptoms in muscular dystrophy. First of all, you will see that the child is having difficulty in getting up from the floor. Then slowly it progresses to difficulty in getting up from the chair. Then you will see difficulty in kneeling and kneel walking, difficulty in climbing stairs. So the lower muscle abdominal walking pattern changes, lordotic gait, walking on the toes, difficulty in walking, difficulty in getting up from the bed. This is progressed much further. Hypertrophy of the tongue, hypertrophy of the calf muscles, difficulty in bed mobility, difficulty in standing or stopping of standing and walking, needing a lot of support, difficulty in hand functioning. Overhead activity becomes very difficult. So function becomes deformities. You can see here the knee and ankle, breathing difficulties and knee deformities, ankle deformities, hand deformities, scoliosis. Spine becomes twisted and the child has to be, it needs a wheelchair and has to be physically. So this is a family in which 3 children were affected. This is a patient on a ventilator finally when breathing problem happens. In congenital muscular dystrophy, floppy child from birth, scoliotic spine, neck holding is difficult. Distal muscular dystrophy, lower limbs and distal muscles. Facioscapulohumeral, you can see winging of scapula and facial muscle weakness. Myotonic muscular dystrophy, cardiac issues as well as difficulty in grip and facial problem as well as speech issues. Other systems affected would be cardiorespiratory issues. Heart becomes weak as well as breathing gets affected. And very important is the bone weakness, osteoporosis, much more seen in muscular dystrophy as compared to regular, leading to a lot of bone pain, difficulty in standing, and also pathological fractures. So how is the condition diagnosed? First of all, clinical issues, clinical problems. Second, generally raised CPK levels in the blood, muscle biopsy showing the typical problem or pathology in the muscles. Immunohistochemistry of the muscles will also reveal which protein is defective, which help us identify the type of muscular dystrophy. For example, dystrophin 1, 2, 3, if it is defective, then it would be DMD. If alpha, beta, gamma, delta sarcanoglycan is defective, then it would be sarcanoglycanopathy. So similarly, the type, which helps us to then do a genetic testing to understand the gene defect and the type of gene defect. EMG or electromyography gives us Diagnostic, it is diagnostic in terms of how the muscle functions when electric current is passed through the muscle. This is a needling test and is important to differentiate between similar looking conditions like limb girdle muscular dystrophy and spinal muscular atrophy. And magnetic resonance imaging, or the MRI of the muscles, helps us to know which muscles are atrophied to what extent and how much is the fatty infiltration. So let's look at the MRI of the muscles, which gives us a very good prognostic value. This is a sequential MRI of DMD children. At the age of 5 years, you can see that this is a cut section of the muscle. All these brown is muscles. You can see a little bit of white, which is the fatty infiltration. At 6, you can see fatty infiltration is slightly more. At 7, the white part is increasing, which shows more and more fat and less of the muscle. 8, you can see a lot of fat, very little muscle. Again, a lot of fat, very little muscle, and you can see progressively hardly any muscle and a whole lot of fat. And finally, at the age of 15 and 16, you can hardly see any muscle. So this is how the progression happens. Another advanced scanning is along with the MRI, is the diffusion tensor imaging, which gives us the idea of the active muscles or the recruited muscles, as we say, during activity. This is the muscle, and all these points, both the red and green, are muscles. Green is an inactive muscle and red is the active muscle. And as you can see the red increasing and the green is still there, but with age, the muscles which is being used to do an activity is increasing. The red increases. Then the red is increasing, and finally you do not see any tissue at all. So with time, you can see that the active muscles or recruited muscle is increasing. More and more muscles are being used to do an activity. And that's functioning. You can see early, this is early at the age of 5, and this is at the age of 21. So what are the current treatments available? What are the current treatments? You can see rehabilitation is the core of all the treatments. Physiotherapy, activity, very, very important. Medical treatment of complications and surgical management of the contractures. If there are contractures, they may be needed to be straightened for improved function. Nutritional supplements are very important, like vitamin D, coenzyme Q, B12. If breathing problem starts, an artificial ventilator can help. Medical treatment also means use of medications for the cardiomyopathies or helping the cardiac function to remain intact. So these are rehabilitation and medical treatment. Some of the FDA approved in case of muscular dystrophies, one is steroids. The other now coming up is the gene therapy. So I will try and summarize this shortly. Rehabilitation, all different types: physiotherapy, occupational therapy, psychological intervention, counseling, very important, aquatic therapy, speech therapy, diet and nutrition, and cardiorespiratory rehabilitation. So depending on the stage, the rehabilitation varies. In early ambulatory stage, when the patient is still walking, you'd give moderate resisted strengthening exercises so that the walking is continued. Cardiovascular endurance, because many times because of fatigue, the child is not able to walk properly. Endurance training for the muscles. Stretching exercises to prevent contractures. Oromotor exercises, because there is tongue hypertrophy leading to difficulty in swallowing, and speech leading to lack of confidence, and counseling overall, how to take care of the child's condition. So these are hand exercise, leg strengthening exercises, gait training, and endurance training in ambulatory patients. Stretching exercises to prevent contractures, oromotor exercises, and counseling. In case of late ambulatory and early non-ambulatory, just the child has stopped walking or the individual has stopped walking, again improve muscle strength, improve aerobic capacity, breathing capacity needs to be improved, prevent the deformities. Again, even if the patient has stopped walking, if we can prevent the deformities, other treatment can work much better. Help modified independence even in non-ambulatory stage, how the patient can be active and can be self-dependent. Phonation exercises to prevent speech issues, and supplements and nutritional intake. So these are all different therapies preventing deformities, very, very important. Bed mobility training so that they can be independent in bed mobility, and aquatic therapy to improve their or reduce the contractures and tightness. In non-ambulatory stage, then you have to here we have to look for preventing complications like correction of deformities, maintaining aerobic capacity, very important because these patients are prone to a lot of chest infection, cough, and repeated ICU stays. So this is very important in a non-ambulatory, late non-ambulatory. You can see here contractures are there. There will be scoliosis. Prevention of scoliosis is one very important thing. Now, in medical management, what medicines do we have? For whatever medicines are there, the aim is to slow down the progression, lengthen the period of ambulation, symptomatic improvement, functioning of daily living, contractures and deformities, and prevent cardiorespiratory functions. So medications. Now, medications can be divided into one major group is the corticosteroids or prednisolone or deflazacort or vicilone. Then in myotonic muscular dystrophy, anti-myotonic drugs like sodium channel and calcium channel blockers, vitamins such as coenzyme Q, omega-3, vitamin E, and other drugs which help the cardiorespiratory condition. Mainly steroids is the mainstay right now for muscular dystrophy. It reduces the inflammation, it helps reduces cell degeneration and reduces muscle breakdown, and thereby to keep the muscle mass intact. There's a long-term study of deflazacort, and how does, in the natural history of the muscular dystrophy, how does it help? It helps to delay the uh, 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 stopping of walking or inability to walk can be prevented using steroids. However, death, the change in death is not seen, or the survival has not been affected so much by steroids. So what are the problems, however, with steroids? Weight gain. The child gains weight, there is water retention, the bones become brittle, osteoporosis increases, vertebral fractures, bone fractures, again leading to non-ambulation earlier, excessive secondary sexual characters like hair growth, acne, also may lead to depression. Cardio has effect on the heart, irritability and cataract. So there are a whole lot of side effects with long-standing steroids, and thereby has to be used very cautiously. Newer therapy or newer medications which is being tried, and there is a lot of interest in it, is tamoxifen. Tamoxifen is a selective estrogen receptor modulator. It has been used in breast cancer. What is the mechanism of action? What does it do? It helps to improve the quality of the tissues, the cells, but it does not make them normal. So tamoxifen improves the histology of the muscle as well as function. It reduces the fibrosis. However, as compared to steroids, it's better. But steroid improves the muscles but does not improve the function. Tamoxifen also, it enhances bone density, so it reduces osteoporosis, while steroids lead to more osteoporosis. So in muscular, as far as tamoxifen has been more studied in mice in the MDX model for Duchenne muscular dystrophy, it has been found that within 1 month there is a decrease in the number of degenerating muscle fibers. So the muscle fibers remain much better, more intact with tamoxifen, and inflammation or the swelling is reduced as compared to the control group. However, this study has been done in mice. In humans, results are still not out. It is still in the phase 3 of the trial, which will be completed in 2020. Now, the approach, gene therapy. Now, there is a lot of interest in gene therapy, and definitely we feel, and everybody feels, that this could be the definitive treatment for muscular dystrophy. Let us see how it works and whether really practically is it going to be a definitive treatment. What can we see here? This is, for example, a DMD patient whose there is a genetic defect. Now you can see that these are different exons which help produce a dystrophin. Between 48 and 51, there is a gap, or there is a 51 deletion. So deletion of 49 and 50 in exon skipping, there would be a skipping of the protein formation, so that even with the absence of certain exons, protein can be formed through the mRNA. Now, the first drug which is FDA approved for exon 51 skipping is eteplirsen. Now, there has been a double-blinded controlled trial for safety and efficacy, and it has been seen that dystrophin expression and function in new muscles has been seen. There is a benefit in 6-minute walk test, and there is slower progression in those who have been taking this medicine as compared to the control group. This is a study which actually looks about the long-term or longitudinal effect of eteplirsen versus historical control on DMT. So, what does it do? The effect of gene therapy on natural progression, however, has not been studied. So, it has been studied for a shorter duration in ambulatory patients. That means children who are walking are able to remain walking for a longer time, or their progression is slower. Because this is a very limited treatment only for exon 51 skipping, the number of children who were able to take this part of in the clinical trial were very limited. Plus, the trial was limited to ambulatory or walking children. So, out of 186 patients screened, only 13 were eligible for the treatment. So, very small number could be treated. And what it shows is the slowing down of progression, and no reversal was seen because the stem cell pool in the muscle was not replenished, only the dystrophin was corrected. Another drug which has been studied for nonsense mutation and has been approved is the PTC124 or atelurin. This looks at the nonsense mutation, that is mutations between the two exons, that is in the introns, which causes premature stopping of the protein formation. Again, atelurin, it has been studied and it has been found that it does help in certain mutation. However, only specific patients can be treated, and also it has been taken thrice a day, making it a very expensive treatment. It again shows slowing down of the progression on a very small follow-up, and the symptoms noted it does not reverse the problem. So gene therapy actually doesn't reverse the problem, hence has to be of course done in very early stages, and long-term effects still need to be studied. So now we have medications, we have steroids. Gene therapy is coming in, but also shows limited promise. So what do we have? Why is gene therapy alone not effective? One, it is generally the carrier for the gene is a virus, and the dystrophin is inserted into the virus. This gene, when is inserted, it has to fit into the virus and has to be manifested in the muscles. But the question is, how effective is the shorter version, because the dystrophin gene is very big. So the shorter version, which has to be put in the virus, how effective it is, we do not know. Another problem is because it is a viral vector, whether the body in which it is introduced, whether it will become immune quickly to the virus and the virus may get demolished. Also, whether the virus will multiply, how much it will multiply. So the matching or the acceptability of every human being for the viral vector would be different. So what is it that we are looking at? How do we approach this very complicated problem? We have to approach it from a different perspective, and that's where the stem cell part comes in. If we look at the pathophysiology of muscular dystrophy, and especially Duchenne muscular dystrophy, it has been seen that these symptoms arise because of exhaustion of the stem cell pool. And this has been shown by a very path-breaking paper which was published in the very prominent journal, that is Cell, in 2010 from Stanford. So first, let us understand how stem cell can help it. When we look at a cell, there would be some defective gene and there would be some normal gene. Even in a normal course of our growth, we do see that there would be mutations in our body which gets corrected of its own. That's why it is seen the actual effect of the genetic mutation starts much later, above 5 years, in conditions like Duchenne muscular dystrophy, because there are self-correcting mechanisms which keep on correcting these gene defects and prevent accumulation of the defective gene. So here is what we have. We have a defective gene which forms a abnormal protein. The stem cells improve the surrounding muscle, the environment, in order to help correct the gene defect, and thereby leading to a better muscle synthesis or better protein synthesis in the muscle. So what does do? Stem cell activates the paracrine mechanism which self-corrects the genetic problem by sending cellular components like ATP, mitochondria, calcium, messenger RNA, and other helpers to correct to the defective cell, to self-correct the genetic defect. And that's why even cells from our own body or autologous stem cells will be effective. So what is the, we had to look at the pathophysiology of the muscular dystrophy. This was already been explained to you. But as I said, muscular dystrophy is a stem cell disease, and hence, if a treatment does not replenish the stem cell compartment, it will likely fail. It would be like pushing the gas pedal to the floor when there is no reserve. So what does that mean? That gene therapy alone, even if it corrects the defective gene, will not function because the necessary raw material, that is the stem cells, has not been provided. So let us see how stem cell works. There are different types of cellular therapy which is being used over a period of time. First, people try to use myoblast from the muscles, but they die very fast. Then there are adult muscle mononuclear cells, which also have not been very effective, have been effective short term. Muscle marrow derived stem cells have also been seen, and bone marrow derived. So these all are effective, though for a short term. How they work? They reduce the inflammation and enhance the repair capacity of the cell. So what are the possibilities with cellular therapy? How do we think that it will be more effective than the other possible ways that other interventions have been tried, like medicines and gene therapy? Stem cells are there in the whole of our body, and there are different types of stem cells that we can use, and they can be used at every age and in every type of muscular dystrophy, whether it is DMD, BMD, autosomal recessive, dominant, whether we know the gene defect or we do not know the gene defect, stem cells can be used in all of them. There are numerous medical benefits of regenerative medicine. These cells secrete trophic factors or growth factors as well as oxygen to help repair and improve the ambience in the muscle. They can help treat all muscular dystrophies. It is a well-tolerated therapy. There are no rejection issues when done properly, and it increases the muscle strength and reverses the problem as well. But we also have to look at what are the shortcomings. The shortcomings are that some of the stem cells are still in the experimental stages. We do see that it is advantageous more in the early stage when there is muscle to be salvaged or saved. Long-term effects are unknown, but how long the effect will remain is still known. We do need to replenish the stem cells at multiple time points because they do have a specific lifespan. There is no randomized control trial, though we have done a few studies, and it could be expensive, and so is gene therapy. So stem cell actually looks at the holistic way to improve the muscle as well as the connections. Just as these different revolutions have helped change the way we live our life, stem cell is now potential to holistically address or approach muscular dystrophy, and this is what I would be talking about. So stem cell therapy is an idea whose time has come, and it has also been included in our standard book, that is the Harrison's textbook of medicine, that stem cell can help Duchenne muscular dystrophy and other musculoskeletal disorders. So what are stem cells? Stem cells are basically cells, specialized cells in our unspecialized cells or immature cells in our body, which can multiply many times and can become any type of tissue depending on the environment. How do they work? First of all, one cell can become many cells. So it has potential to multiply many times. The cell, depending on where it is put, can become liver cells, cardiac cells, blood cells, and nerve cells. They release many factors. Now this is one of the most important mechanism by which stem cell work. They release antioxidants, they release oxygens, they improve the healing capacity by the paracrine effect of the cells, improve blood supply, which again helps in repair and regeneration. So what are the different types of stem cells? The stem cells are, one is the embryonic stem cells, which is currently not to be used for transplantation medicine because of ethical issues or and long-term problem of teratomas. However, we do have mature stem cells which can be used from the patient's own body. So bone marrow derived stem cells, which have multiple types of cells in them, have seem to be the most effective for autologous use. Patient's own bone marrow stem cells can be used. Cord blood stem cells again are another type of cells which are very attractive and in the long term could be assessed for use for transplantation medicine. So we choose to use adult stem cells because they are safe. We take the cells from the patient's own body. They are non-tumorigenic. There are no rejection issues. They're easily obtainable. It doesn't require a big surgery, and there are no ethical issues. We are not killing any embryo here. So what is the scientific basis of stem cell therapy? A lot of research has happened over a period of almost 50 years, and Nobel Prize has been given at 3 time points for stem cell research and therapy. Even our own ex-president from India has talked about stem cell research as a big part of research in India. Prime Minister had gone to meet the Nobel laureate to see how stem cells, the induced pluripotent stem cell technology can be brought back to India. A lot of support in terms of for muscular dystrophy from our Prime Minister, whose own state or constituency has a lot of muscular dystrophy, who has written a preface for the book that we have written, the Patient and Parent Guidebook for Muscular Dystrophy. The other neurological disorders which can be treated, just to give a brief understanding: autism, cerebral palsy, intellectual disability, muscular dystrophy, and other neurological conditions. We have done a lot of work on use of bone marrow derived stem cells in many different disorders, with over 17 to 18 publications in muscular dystrophy, with overall 86 publications in all neurological disorders. So how is the treatment? It is a very simple process done in 4-step. Bone marrow is aspirated from the hip bone. Stem cells are processed in the laboratory where the red thick bone marrow, from there we get the mononuclear cells, which are white blood cells containing a mixture of different type of stem cells, and then they are injected into the spinal fluid as well as into specific muscles on the body as assessed by our physiotherapist. So bone marrow aspiration, separation of stem cells. You can see here millions and millions of stem cells here, checked and counted. Part of it injected intrathecally into the spinal fluid. This is a different type of approach only done in NeuroGen. The cells which we are injecting contain different types of cells. They contain hematopoietic stem cells, mesenchymal stem cells, multipotent progenitor stem cells, as well as very small, each of them having action, and they work in tandem. Why injecting into the spinal fluid? Because then it helps improve the connections in the spine. In muscular dystrophy, people always ask us, why into the spinal fluid? The rationale is as so. There has been study way back in India itself in 1973 where 1,348 cases of muscular dystrophies were studied, and they found that 23% showed atrophy in the muscles and nerve degeneration. So there is an overlap between denervation and myopathy, and so there is a nervous system component, both central and peripheral nervous system component, in every muscular dystrophy patient, and hereby improving or strengthening the muscle connection and the nerve connection makes a lot of sense, and that's why we inject into the spinal fluid. Also, we inject into the muscles at specific motor points. You can see here there is a mark. This is where the stem cells are injected into the muscles. Now, the motor point marking is a very scientific process which has been which has come or been innovated by NeuroGen Brain and Spine Institute and our physiotherapist. Our physiotherapist first check the muscles, the whole muscles in our body. They do manual muscle charting. Also, we do MRI of the muscles to understand which muscles are atrophic, and we they determine which muscles need to be strengthened to improve the function of a person. These muscles are then stimulated to find the point in the muscle where the nerve enters. These are known as motor points. Those are marked. Those are the point if when stem cells are injected, maximum contraction can be stimulated. So these stem cells are injected one into the spinal fluid where the spinal cord and nerve connection is there. The other end is the muscle where the nerve enters the muscle. So we are strengthening the whole circuitry at two ends. This is very important to understand why the stem cell process in NeuroGen is different, because it is a very scientific and thought out program followed by rehabilitation. Now, when you do rehabilitation after stem cells are injected, that means there is more fuel for the muscle strengthening to happen both at the nerve level as well as the spinal cord level. And that's why the effect of the stem cell treatment with rehabilitation becomes more prominent. So this is how motor point is marked. You can see a physiotherapist stimulating using Faraday current, and the point where she he sees maximum contraction is marked, and that's where stem cells are injected. So why autologous and why bone marrow? There is no major side effect to using patient's own stem cells. It's a very minor procedure and it can be done under local anesthesia. Very minor effects like headache, nausea, vomiting, hence absolutely safe, 100% safe. No rejection issues, no chemotherapy medication, no matching is required. And that's the beauty of this treatment. It is simple, it is safe, and we will see how effective it is. So how do these stem cells work in muscular dystrophy? We have seen the pathophysiology. If you remember, I keep on talking about this because this is important. First, there is a gene defect. So with the paracrine effect, the gene defect or at the cellular level, the paracrine effect will help to correct the defect in the muscle cells. There is exhaustion of the stem cell pool. So when you provide the stem cell pool, the muscle can now recruit these stem cells to stimulate the myoblast or satellite cells in the muscle so that the immature cells can become mature functioning muscles. There is a chronic inflammation, there is swelling in the muscles, and again the stem cells release cytokines which act as anti-inflammatory agents and reduces the inflammation. So you can see a combination of what steroid and tamoxifen does, and as well as gene therapy. So stem cell is a holistic therapy which has the effect of all of these different interventions in one system. Vasogenic ischemia, that is the blood supply to the muscles, is reduced in muscular dystrophy, thereby causing more damage, and stem cells will go and improve the blood supply by neoangiogenesis, formation of new blood vessels. Upregulation of There is an upregulation of apoptotic process in muscular dystrophy. What does that mean? It means that naturally there is a cell death process in our body. In muscular dystrophy, that process happens faster. What stem cell does is reduces this apoptotic effect so that the cell death is reduced. Again, the fibrosis, which is a natural progression or natural problem in muscular dystrophy because of the release of chemicals which has anti-fibrotic effect, the fibrosis is reduced. Again, the nerve connection to the muscle is strengthened because of at the synaptic junction, improving the neuromuscular junctions. So stem cell acts at in 7 different ways, which then becomes a combination therapy with one way, which is effective for all different types of muscular dystrophy. So what are the clinical results? Now let us look at what is NeuroGen experience. We have treated over 1,970 muscular dystrophy patients of various different types. Some of our data is here. This is our unpublished data in Duchenne muscular dystrophy, where we are looking at 261 patients who have been treated with stem cells, 55 untreated, which acts as a control group, which are doing only rehabilitation. Their follow-up period is a median of 22 months, ranging from 6 months to 79 months. What was studied was children's ability to walk, children's ability to eat, total survival of the children, changes in the muscle strength, and progression of the disease. All these were our end times or study points. So we studied the age at which boys who received stem cell lost their ability to walk and compared it with the age at which boys who did not receive stem cell lost their ambulation. So boys who received stem cell therapy were estimated to walk for 13 months more. So about a year and more they were able to walk with just one stem cell procedure. This is the graphical representation. Green is the line where children who had received the stem cell treatment as opposed to children who did not receive the stem cell treatment. You can see the difference in their ambulation, 13 months more. Ability to eat. Those children who received stem cell, they were able to eat on their own by bending the elbow to lift the hand to the mouth. So the hand-mouth function or upper arm function improves using the Brooks scale. That is how we studied it. And the boys who received stem cell therapy could lift their arm up for 3 years more. So ability to eat, which we take for granted, is much better preserved with stem cell therapy than those who did not take stem cell. So this again is a graph. You can see that ability to eat is remaining preserved for a longer time till the age of 21 years as opposed to 17.9 years in untreated or those who did not receive the stem cell treatment. What we also studied is the survival in these children. We studied the survival as compared to those who did not receive, and we found that the survival is increased by a minimum of 3 years. So those who received stem cell, they survived 3 years longer than those who did not receive the stem cells. Again this, so those who received stem cell were survived for almost 25 years as compared to 21 in those who did not receive stem cell treatment. Okay. We also studied how fast the disease progressed. This is important before and after the stem cell, and progression of the disease was considerably slowed down after the disease. Disease progression estimated to slow down by 5.75 years, almost 6 years after the stem cell treatment. Progression of disease before the stem cell treatment and progression is slowed down after the stem cell, which was statistically significant. You can see the difference. So the total muscle strength before and after the stem cell was also calculated. What we can see, the natural history is that there is a muscle decline by 4% every year. As opposed to that, in age group of 5 to 13 years, we found that the muscle strength decline after stem cell is only 1%. So there has been at least a 3% reduction in the muscle strength reduction. Above 14 years, muscle strength decline was 2% in natural history on unintervened patient, as compared to that only 1.14% per year in those who are above 14 years. So stem cell therapy slows down the rate of muscle weakness. So when we look at how was the the progression after stem cell in different symptoms, we can see that blue is improved, the red is the same or stationary, and green is deteriorated. We can see that the posture is at least maintained in almost 60% of the patients, with 70% showing improvement. Rolling is but better in 44%. Walking is been maintained in 70% of the patient. Standing maintained in 57% of the patient. So most, at least we are able to make them at least maintain or stabilize the disease condition, and you can see 15 to 20% improvement in many of these symptoms. Similarly, in contracture scoliosis, at least it is maintained in most of the children and improved in between 15 to 30%. If we look at the natural progression before the treatment and after the treatment, we see that the MRI before the treatment and 6 months later or 12 months later, the progression is maintained. So that the fatty infiltration you can see before the treatment, after the treatment is not increased. That itself is a big advantage. Again here, before the treatment, the muscle recruitment is same as after the treatment. So comparison of fatty infiltration before and 6 months after, there was a significant halting and slowing of progression in the fatty infiltration. So not only clinically, but also as far as MRI is concerned, the fat fraction which indicates progression was stabilized. Comparison of the DTI, that is a fractional anisotrophy, also in different ways. These are in imaging, we can see that there is a stabilization of the disease. Our published data for the last 9 years, we have shown there is a improved quality of life in muscular dystrophy. We studied 150 patients of different type of muscular dystrophy with 87% success rate. This is a mixture of all these different types. Improved in the trunk strength, upper limb strength, lower limb strength, starting to walk and standing. Also in DMD patients. So these are our results of our various publications which we have published previously. You can see that 88% success rate in DMD patients, improvement in various symptoms as well as seen before and after the treatment, significant improvement in upper limb, lower limb and trunk strength. Also reduction in CPK, shifting in functional score, improvement in MRI and EMG has also been published in our papers. Limb girdle muscular dystrophy, 20 patients which we studied in one of our initial papers, again 80% success rate. In Becker's muscular dystrophy also we have seen a 5-year longitudinal study in limb girdle muscular dystrophy which was published with 59 patients. We have seen that there is an improvement in the manual muscle testing of the patient who underwent in various different muscles as compared to before the treatment. These are different muscles. We have seen there is an improvement in the muscle strength, or at least stabilization is seen. So what do we see overall? What we see is that this red line is a natural progression of the disease. Sorry. And here is the progression of disease in the patients that we have treated. What we see is that after the stem cell transplant, we are able to stabilize the disease progression. So what you see is a hidden improvement. We have published about 18 publications and in different ways we have published. All these are available online for you to have a look at it. All these are our publications in different type of dystrophies as well as case studies. This is our book chapter that we have written on imaging of the musculoskeletal. We do see an improvement. As I said, this is a fatty infiltration. You can also see muscle fibers here. Before the treatment, very little muscle, and after the treatment, you can see that the muscle fiber has increased. Another example, all this fatty infiltration before and after, you can see some muscle recruitment or regeneration has happened. What is the general experience in the world? Let us see what type of different. So a lot of work, in fact, has been done by majority of work in muscular dystrophy or the published literature is from NeuroGen, Alok Sharma et al. You can see all of them using intramuscular and intrathecal bone marrow derived mononuclear cells without any side effect or adverse events reported. There has been a paper on intrathecal umbilical cord derived hematopoietic stem cell where they have shown that the first stem cell transplant did show graft rejection and autologous reconstitution. So there is a problem when there is a allogenic stem cell used. Intramuscular muscle precursors have also been used, but way back in 1995 and in 2004, nobody has really followed up now recently after 2007. So intramuscular muscle cells had been used previously, but of late we do not see so much of muscle stem cells being used for various reasons. So let us look at. Yes, we have seen clinical improvements, graphically significant. We have seen MRI muscles improved, but let us see what is that we see in the patients. So this is after 1 month. Immediately after the treatment, you can see here this child having difficulty in getting up before the treatment, unable to get up in fact, but here after the treatment, he is able to get up from the floor, though slowly. This is immediately improvement seen after a month. Here he is attempting, but here he is able to do it. This is improvements after 1 month. Earlier, even the lung capacity or breathing capacity, he was not able to blow the candle. Here he is attempting to blow the candle and is able to extinguish the candle. So breathing capacity is better. Now in water, let us see aquatic therapy that we do after the stem cell procedure is able to do trunk. Here he needed help from the therapist. Here he is doing on his own. This is before the treatment. Climbing stairs were very slow. This is 1 month after the treatment. So we start seeing changes in a month with good rehabilitation after the stem cell treatment. The effort required is less. This is another child of the same family who was 12 years old and unambulatory with a lot of deformities. The brother of the previous child. Earlier you can see that rolling was very difficult. He is now rolling very, very fast. These are improvements seen in 1 month. Standing without support earlier, it was very difficult because he had contractures. Now with contractures being reduced, he is able to stand even in parallel bar and with maximum assistance able to take a few steps. In water, he is able to walk independently. So these are the changes that you can see in 1 month in this child. So this child is 12 years old, had come with deformities and was non-ambulatory. So walking in water becomes much easier and the child now is able to walk much more independently on land. So first you do walking and then first in water and then on land. This is how you progress with stem cell and rehabilitation. There is an improvement in the muscle strength, in the balance, in the core strength of the body. And after you can see he is walking independently in the water in 1 month. So this is the changes we see in 1 month. I'm going to show you improvement in 1 month, improvement in 3 months, 6 months, 9 months, 1 year. This way in different patients. So you know how gradual improvements are possible. This is the third brother in the same family. I had shown you a family of 3 patients. This boy, 15 years old, severe contractures. You can see here, severe contractures. Here the knee tightness is reduced. He earlier was not even able to do abduction, not able to keep his leg in his control. Here you can see that he is able to move his legs. Even the hand, there was severe contracture. He could not abduct his hand. Now he is able to initiate some activity. Here the sitting, he needed so much support from the therapist. Now he is able to sit independently, hold the ball and throw the ball. Before the treatment, he could not do trunk flexion. He could not bend from his back. You can see that the therapist is having to give maximum support and assistance. Now he is able to do it on his own, initiate the movement without any help. This is in a 15-year-old child in 1 month. Now let us see in the water. Trunk flexion in water. You can see that now he is able to do it on his own with just hand support from the therapist. Earlier he needed support to even move his wheelchair. He required assistance. Now you can see after the treatment, you will see that the assistance required is not there and he is now competing with his younger brother who is 12 years old and winning and able to use the wheelchair, and that means upper limb strength is much better. So this is a family of 3 children, different ages, in which we saw improvement in 1 month. This is an example of a child with congenital muscular dystrophy, which you can see there is a lot of problem in respiratory functions, and you can see that before the treatment he could hardly sit, could not blow, could not turn. He can now do sitting activities, turn better than before. You can see the posture is much better, use of hands is much better in these children. Another examples of improvement in 5 months. You can see before the treatment, this child is hardly able to get up. Now he is able, though with difficulty, able to get up on his own. He is able to stand and walk tandem walking, as well as able to do climbing of the steps on his own with less effort in 5 months. Rolling required, you can see rolling requires very little effort. Kicking and um, all fours is much better. Earlier he needed help. Improvement in a 14-year boy from Turkey in 5 months. You can see here before getting up required so much effort. After the treatment in 5 months, ability to get up very fast. Turning or rolling in the bed was so much more difficult. Now he is able to roll very fast. This is the core strength improvement. Hand function, you can just see the difference. Earlier he needed to use another hand to lift it up. Now he does on his own. Before the treatment, we used to make him stand with maximum assistance. After the treatment, within the few days that he was with us, we started training in aquatic. Now he stands with minimal support. He doesn't need complete support. He was wheelchair bound completely earlier and with very little hand function. After the treatment, the gait training in water was started, walking with support in water, then walking with one physical assistance on the land with a walker at home where parents and therapists are training. So this is where he has reached in 5 months. A 46-year-old muscular dystrophy who was completely bedridden took a lot of time to make decision to come for treatment, but once he came he was very thankful and happy. Initially you can see the therapist is helping him to roll. Even rolling in the bed was needed support. Now he is able to roll on his own. Before the treatment, he needed support to sit up. The therapist is pulling him to sit up. Now he is able to sit with very little assistance and almost on his own. A very happy individual. You can see that earlier everything required support, and now he is able to do activities on his own, getting up on his own with only the therapist there for supervision. You can see that he is able to get up on his own and stand up. Earlier he needed help. Earlier he could hardly walk or not even stand. Now he is able to walk independently with the walker. He can now shift in the bed, which was not at all possible, which you can see now he is able to do. He is a different person. He could not raise his hand to drink water. Now he is able to do so independently, attempting to climb a step, not only walk, but climb a step. This all happened in 6 months after the treatment. Progressive improvement with good rehabilitation after the stem cell treatment. Now let's look at what can be seen in 9 months after the treatment. Before, the crawling speed was very little, kneeling was very difficult. Now the patient is able to do it without effect. You can see her walking near normal. You can hardly make out any problem in the gait. Posture, balance, use of upper limbs, stepper activities where she needed a lot of coaxing, climbing the stairs, beautiful improvement, stepping over the stepper which we saw, getting up from the floor. I'm sorry, there is some technical problem that you're not able to see. Getting up from the floor, now she can do in 5 seconds, which was not possible earlier. And maintain one to stand without any support with leg together. So these are the improvements in 9 months. A 9-year-old child from Turkey, and let us see his improvements after 1 year, whether they are still there. You can see the rolling, getting up from the floor faster, kneeling with minimal support. You can see that he doesn't need any support for kneeling now as compared to before. Using upper limb, taking weights in the hands. Now it is possible standing on one leg. very, very stable. This is the improvement and sustained till 1 year. Picking up objects from the floor. Big objects can be done faster. Getting up from the floor, you can see the timeline there. Earlier is attempting to get up, but hardly able to get up. With the stem cell treatment, you can see that he is able to get up. Let us see how much time it takes to get up. In 16, 17 seconds, he is able to get up. But before the treatment, even after 29 seconds, he's still attempting to get up. This is the difference before and after the stem cell treatment. A 16-year-old boy who had difficulty in getting up from the floor, walking, climbing stairs, and cycling. After the treatment, he has attained near normal strength, able to get up very easily from the floor, able to do kneel walking without support, able to walk without support. You will see he goes to school about 8 kilometers away from his home. He comes from a rural part of India and is now able to ride a bicycle to his home. Stability, earlier he needed support for every activity. Now he does things independently without any support. You can hardly make out that he has muscular dystrophy. You can see him riding a bicycle independently to the school. So this is functional improvement at home. 8-year-old child who was in 1 year, you can see the difference. Rolling was difficult. Now he's rolling very faster. Core strength. Getting up is much quicker from lying to sitting, much more easier. You can see that he is able to get up without any difficulty. Earlier, he needed splints to support in his all fours walking. Now, the elbow strength has improved. He doesn't need support. Abdominal muscle strength has improved. You can see that he is able to do side mobility as well as back and front without any help. Earlier, you can see the effort that he is making. He was non-ambulatory and his father used to take him to school, carrying him. Now he walks to the school on his own. And this is what we are looking at, ability to wear his own t-shirt and self-help independence. That's the key to this treatment, and that is what we are able to achieve with stem cell procedure. Again, a 2-year follow-up of a boy who came to us from Bangladesh. Look at the difference which is still maintained after 3 years. Ability to walk, march, ability to do knee walking, ability to run, play outdoor games, perform bowling, perform running between the wickets, playing cricket, that was his dream, playing badminton. He is able to do all that after the treatment for 2 years. Though yes, we do need replenishment in between. This is an amazing example of a 17-year-old boy of muscular dystrophy who was like this in 2011, maintained till now in 2017, maintained 6 years in upper limb activity, ability to do activity, ability to take care of himself. He stays at home alone. His parents go to work, and from 9 a.m. in the morning to 6 in the evening, he is able to take care of himself even though he is on wheelchair. And that says a lot for his own endurance, for his own willpower, as well as how stem cell has helped him maintain even with a compromised heart. This boy is still alive and kicking. He's able to drink, he's able to eat on his own, he can go to the bathroom, he's able to use his laptop, and he is independent within the home. So this is a boy who's 25 years old. So what about any complications with the use of stem cells? There are no major adverse events, no neurological deterioration, very minor if at all. Those who have a history of seizures, maybe 3%, spinal headache and nausea and vomiting. So adult stem cell therapy looks to be a safe option for muscular dystrophy. Newer directions, there is a possibility we feel if it's possible, we are looking at those options of combining gene therapy with stem cell, maybe the best combination ever. That is something to think of. This is NeuroGen Brain and Spine Institute in Mumbai in India, where the treatment is done, holistic treatment. We have treated over 6,750 patients from 65 different countries. This is, we are on the lake side in Navi Mumbai, a very well constructed city of Maharashtra. This is our state-of-art stem cell laboratory and operation theatre with an in-house stay facility for the patient, comprehensive rehabilitation under one roof, a multidisciplinary team working at a holistic approach to neurological disorders with facilitation of rehabilitation of all different kinds, including cognitive. It's a combination of stem cell and neuro rehab, where the stem cell need nourishment and the nourishment comes through the neuro rehabilitation. These are all the different therapies that we do: pediatric, adult, pediatric occupational, adult occupational, speech therapy, psychology, special education, diet, with all rehabilitation together under one roof, with a scientific approach in terms of publications as well as books that we have written for doctors and for therapists. This is our core team of Dr. Alok Sharma, who's a neurosurgeon, and the vision behind this combinatorial approach, myself, Dr. Nandini, Dr. Jacob, who is the head of neurorehabilitation, experience of over 50 years, Dr. Prerna, who's a stem cell expert and has been the core of the whole treatment, Dr. Himangi Sane, the head of research as well as a physician herself. Accreditation both for the laboratories as well as our awards for various from European Medical Association as well as from various different from national as well as international bodies. Our award from our own Chief Minister of our state, and thank you for patient hearing. I hope you have been able to hear me talk, and some of the concepts on muscular dystrophy have been cleared. This is my Skype and email ID. You can reach me anytime, and I would be now taking questions. So the questions have come from various sources. Mr. Kyriakos from, I don't know from where, has asked that I am at 42 years old and I have limb girdle muscular dystrophy. I'm sitting on wheelchair from 5 years. Can I have better results with your therapy, or is it only promising? Now, 42 years old, limb girdle muscular dystrophy on wheelchair. Mr. Karakos, I hope you have seen the example which I showed of a similar patient like you. And yes, there is a possibility that we could help you. Kindly reach us directly on the email which has been given here or from our website, and send us all the details. We would definitely try to help you. Mr. Sanjeev Kumar asked about, can tamoxifen be taken? It is still under clinical trial. So far, we have not found any side effects being reported. That is something which you can choose to take, but under medical supervision. Without medical supervision, please do not take it on your own. From Akash Bharadwaj, what about microdystrophin? Is this going to be available? We would, all these are still under the process of being understood how it helps. We do hope that microdystrophin helps, but if you remember, I did mention that problem with reduced or a smaller dystrophin molecule is we do not know how much of the normal dystrophin protein it will form. The other challenge, which I did not discuss previously, is the approach of forming dystrophin has been tried before. In fact, dystrophin protein has been injected to see whether it can help. However, because the body has never seen dystrophin, antibodies many a times are formed against this protein, killing the protein as well as the muscle tissue. So the approach of forming new dystrophin to correct muscular dystrophy somehow doesn't seem to be very lucrative or seem to be very successful so far, but time will tell. Any other questions? No. So you can still reach me for any questions on my email, drnandini76@gmail.com, or contact@neurogenbsi.com. Or you can Skype me at Dr. Nandini76 and would be happy to send you answers or have a private chat with you. Thank you for patient hearing and do reach me.